Okay, good day, future nurses. We'll be talking about your pharmacology still. So let's recap on atropine. When I talk about atropine, we have mentioned yesterday that it's a sympathetic drug. Tama? Now, when I talk about your sympathetic nervous system, remember that it is a component of your autonomic nervous system. Okay? It is one of the component of your autonomic nervous system. Since component siya ng autonomic, is it voluntary or involuntary? Is the control voluntary or involuntary?
Involuntary.
Involuntary.
Involuntary, sir.
Okay, so class, the tendency is that its control is involuntary. Okay, ang control niya is involuntary. Okay, that's one thing that you need to remember. Now, since they are part of your autonomic nervous system, they also have what you refer to as your neurotransmitters. Okay, can you recall your neurotransmitters? Sige, what's the neurotransmitter for the sympathetic nervous system? Again?
Norepinephrine, sir.
Okay, very good. So you have
Norepinephrine and
your
epinephrine.
epinephrine and norepinephrine. Okay, so those are the two neurotransmitters for your sympathetic nervous system. Since your neurotransmitters are epi and norepinephrine, again, I would like to recall what would happen to the heart rate, what would happen to the blood pressure when we are talking about sympa nervous system.
Increase, sir.
Okay, they will all
Increase.
increase. Okay, they will all increase. Now, medyo mag-specific kita ha. Let's go more specific towards your sympathetic nervous system or your SNS. So we agree that heart rate and BP will all increase. How about your blood vessels? Will it be constrict or dilate? Will it be constrict or dilate?
Constricted, sir.
Constrictor.
Okay, very good. So there will be vasoconstriction. Okay? If ever you would forget kung ano matabo, try to remember that in sympathetic nervous system, the heart rate and BP would increase. Okay? Heart rate and BP would increase. Now, if you would look at the physiology of the blood vessel, what do you think can increase the blood pressure? Is it the constriction or the dilation? What can increase the blood pressure?
Constriction.
Okay, it is the constriction. Okay, it is the constriction. Now, if we will go deeper, what actually happens is that there is peripheral vasoconstriction. However, there is coronary artery vasodilation, coronary vessels vasodilation, okay, or coronary vasodilation for that matter. Okay? Now, if you would look at the point, bakit magba-vasoconstrict on the periphery pero si heart nagdadilate? Di ba another name for our sympa response again is your fight or flight response. And if you're doing the fight or flight response, your heart would want to exert more effort. Okay? Your heart would want to exert more effort. So, anong purpose nga ang nag-vasoconstrict pero nag-dilate ang coronary? It's to give more blood to your heart. Okay? It's to give more blood to the heart. Are you getting the point? Okay, so that's what's happening in the blood vessels when it comes to sympa nervous system. Sige, we've talked about your urinary. Yesterday, we mentioned about GU and GI. And what happens on the functioning of GU and GI? In sympa nervous system.
Ma-decrease, sir, or ma-low.
Okay, very good. It will be decreased. And again, the main purpose of that is that there will be urinary retention or there will be water retention. And that is geared towards increasing also your blood pressure. Okay, that is intended towards the increase of your blood pressure. Now, let's talk about the functioning of adrenal gland in sympathetic nervous system. What do you think will happen to the functioning of adrenal gland? Will it increase or decrease? Let's go back to the neurotransmitters. No? Earlier, we mentioned that the neurotransmitter is epinephrine and norepinephrine. If I would look at physiology, what part of the body produces epinephrine and norepinephrine?
Adrenal gland, sir.
Adrenal gland. So in the sympa nervous system, what would happen to the functioning of adrenal gland? Increased or decreased?
Increase, sir.
It will be increased. Okay, it will be increased. Okay? Now, let's have a short recap about your adrenal gland. When I talk about your adrenal gland, future nurses, there are three main functions of the adrenal gland. and it could be summarized by your SSS. Anybody can tell me what is triple S?
Salt, sugar, and
Sugar, salt, and sex.
Very good. You have your salt, sex, and sugar. Salt, sex, and sugar. Now, let's talk about the salt. For your salt, guys, it is because your adrenal gland produces your mineralocorticoid. Okay, it is because your adrenal gland produces your mineralocorticoid. And one very good example of that is your aldosterone. And when I talk about aldosterone, what particular electrolyte does it hold?
Sodium.
Sodium, sir.
Very good. Kung kaya, class, tinawag siyang salt. Okay? Kung kaya, class, tinawag siyang salt. Okay? Now, sex. For your sex, you have one hormone, for example, you have your androgen. Okay, you have your androgen, which is in charge of our secondary sexual characteristics. And for your sugar, we have what we refer to as your glucocorticoid. So class, for your glucocorticoid, its function is also to increase the blood sugar of the body. Okay? So pag stressed kita, it is the adrenal gland who will be working to release your salt, sex, and sugar. Other than that, your adrenal gland also releases your epinephrine and norepinephrine. It releases your epinephrine and norepinephrine. Okay? Now guys, your adrenal gland, by the way, has two parts, no? You have your adrenal cortex and adrenal medulla. Who produces the salt, sex, and sugar? Is it the adrenal cortex or the adrenal medulla?
Adrenal
Cortex.
Okay, so remember class, your salt, sex, and sugar is produced by your cortex. Okay, your salt, sex, and sugar is produced by your cortex. Okay, tandaan ha. Now, let's talk about your RAS. No? What's RAS? Can anybody tell me what's RAS? RAS.
renin, aldosterone.
Okay, good try. So renin, angiotensin, aldosterone system. Okay, angiotensin comes first before the aldosterone. Okay, I remembered that because we mentioned aldosterone. Now, your RAS class is a system of our body that is intended to ensure adequate blood volume. Intended to ensure adequate blood volume. Don't need to memorize that. Just remember blood volume for RAS and understand it later on so that you will know its function. Now, let's talk about your renin, or let's talk about first the trigger of your RAS. Plus, RAS is a system in our body. It is triggered if your body would have low blood. Okay? If there will be low blood volume, your RAS will be activated. Technically, what actually happens is that there is low or there is poor oxygenation of your kidney. Okay? Poor oxygenation of the kidney. Okay? Which means that pag konti yung blood na dumadating kay kidney, ma-activate si RAS. And that activation will be started by renin. And who releases renin? Who releases your renin? That will be your kidney. Okay? Si kidney. Kasi kidney will think, uy, mababa yung blood flow papunta sa akin. Let's release renin and let's activate the RAS. Okay? So it's released by your kidney. And what does your renin do? Your renin will convert angiotensinogen to angiotensin. Okay? Your renin would convert angiotensinogen to angiotensin 1. Okay? Now, angiotensin. When I say angiotensin class, your angiotensin is a vasoconstrictor. But there are two types of angiotensin. So you have your angiotensin 1 and your angiotensin 2. Your angiotensin 1 is converted to angiotensin 2 by what enzyme? Have you heard of ACE? What is ACE? Sige na, what is ACE? Your ACE stands for angiotensin converting enzyme. Okay? Plus, the meaning of the word itself or the meaning of the acronym itself tells you what it does. It is an angiotensin converting enzyme. Meaning it would convert angiotensin 1 to angiotensin 2. Kuha? Okay. Now, which is more potent? What do you think? Who is a more potent vasoconstrictor? Is it your angiotensin 1 or your angiotensin 2?
Angiotensin 2.
Okay, so class, the potent vasoconstrictor is your angiotensin 2. Okay? Now, if you would go back to the story, okay, what happened? Nag-low blood volume, tapos konti yung oxygenation papunta kay kidney. Sabi ni kidney, let's release renin. And after renin was released, angiotensin 2 is coming into picture. Okay, that's already our RAS, di ba? Ra. Okay, nandiyan na tayo sa Ra, RA, angiotensin 2. After class, your angiotensin 2 is released, the next hormone class that would be released is your aldosterone. Okay, and as we mentioned earlier, what electrolyte does aldosterone hold on to?
Sodium, sir.
Okay,
Sodium.
sodium. And once there will be sodium retention, what's the next thing that comes with sodium?
Water.
Water retention.
Very good. Very good. Okay? Now, try to connect the story. Bumaba yung dugo, inactivate si renin, nag-vasoconstriction using angiotensin, tapos nandyan si aldosterone to hold on to water. So overall, what's the overall effect of your RAS when it comes to your blood volume? Will it increase your blood volume or decrease the blood volume?
Increase, sir.
Increase niyang blood volume. And what will happen to the blood pressure? Will it be increased or decreased?
Increase.
Increase, sir.
Increase niya rin yung blood pressure. So kumbaga, parang coping mechanism siya ng body natin na, uy, mababa yung dugo sa katawan natin. Let's increase the blood in our body using the RAS or the renin-angiotensin-aldosterone system. Kuha? Okay? Sige, I hope that you'll be able to absorb that. Now, since we've talked about also your aldosterone, aldosterone is commonly contrasted with ADH. What is ADH, future nurses?
Antidiuretic.
Antidiuretic
Very
hormone.
good. You have your antidiuretic hormone. Okay? Now, pag titingnan natin guys kung ano yung antidiuretic hormone, as the term implies antidiuretic, does it make you pee or hold your pee?
Anti-P, sir.
Okay? Anti, di ba? So hold or parang anti-pee siya. Okay? Meaning in other words, what does it do with water? Is it water excretion or water retention?
Retention.
Retention.
Water retention din siya. So parang the same sila ng function ni aldosterone. Okay? But your antidiuretic hormone, okay, your antidiuretic hormone or your ADH did it by just holding water. So pag sinabi kong ADH, water retention. Pero pag sinabi kong aldosterone, it's sodium and water retention. Okay? Pag sinabi kong aldosterone, and it's sodium and water retention. Okay? Now, what part of the body produces your antidiuretic hormone?
Posterior pituitary gland, sir.
Tama? Okay?
Ay,
I thought, yeah, tama. Yeah. Okay? It's your posterior pituitary gland. Okay? It is released by your posterior pituitary gland. Okay? More technical, okay? I use the term released, posterior pituitary gland, because it's actually produced by your hypothalamus. It is produced by your hypothalamus, but then it is released by your posterior pituitary gland. Okay? Now, posterior pituitary gland, remember POA. Your posterior pituitary gland only releases two hormones. So your posterior releases, what's the O?
oxytocin.
Very good. Oxytocin. And then another one is your ADH. Okay? Yan lang talaga yung dalawang hormones na nire-release ni posterior pituitary gland. Okay? So again, main message, antidiuretic hormone is just water retention. Aldosterone, sodium, and water retention. So that if you will be studying diabetes insipidus, SAYAD, you would understand that it's just water retention. Pero if you're studying, what do you call excess functioning of your adrenal gland? What syndrome is that? They are patients who would appear with moon face, buffalo humps.
Cushing, sir.
Cushing, sir.
Very good. Okay, kanami. Very good. That will be your Cushing syndrome. And what will be the opposite of your Cushing syndrome?
Addison's.
Okay, so
Addison's.
reduced functioning, that will be your Addison's disease. Okay, so if you're studying these problems, Here in the antidiuretic hormone, your problems are DI, diabetes insipidus, and SAYAD. Okay, and here in the adrenal gland, your problem are Cushing and Addison's disease. If you would study the signs and symptoms, that would just go back to simply antidiuretic hormone, water retention, aldosterone, sodium, and water retention. Okay? Sige. So I hope you are able to absorb that one. Let's go back to our main concern, your sympathetic nervous system. So it's your SNS versus parasympathetic nervous system. So again, quick recap. What happens is that your heart rate would increase, your BP would also increase. And then your GI and GU, it would decrease. What else? Eyes. What would happen to the eyes in sympathetic nervous system?
Dilated, sir.
Okay.
Dilate.
Again, as I mentioned yesterday, one term for your dilation is mydriasis. Okay? Mydriasis. Now, what do you think will happen to the bronchioles naman in your fight or flight response? Will it dilate or constrict?
Dilation.
Dilate.
Dilate, sir.
Okay. So, you just go back to the scenario that hinahabol ka ng aso. Since the dog is running after you, you would want to have more oxygen for your body. Your bronchioles would also dilate. Okay, so there will be bronchial dilation. Sige. So, that's your SNS. The opposite of it, obviously, will be your PNS. Now, if your SNS, guys, would have adrenaline, what does PNS have? If your SNS, I mean, would have epinephrine and norepinephrine, what is the neurotransmitter for your PNS or parasympathetic nervous system?
Acetylcholine, sir.
Very good. Okay, you have your acetylcholine. Okay, you have your acetylcholine. Okay, now, since your PNS would have acetylcholine as the neurotransmitter, another name class for your PNS is cholinergic. Okay, another name for PNS drugs is cholinergic drugs. Okay, so you have the term acetylcholine. Okay, now, ano yung another term class for, what do you think is another term for SNS drugs? What do you think is another term for the SNS drugs? You have?
Adrenergic, sir.
Okay, you have
Anticholinergic, sir.
adrenergic. Okay, adrenergic. Sir, anong connects ang adrenergic sa epinephrine nor epinephrine? Okay, adrenal gland. And other than that, in the past, they thought that it is adrenaline that triggers your sympathetic nervous system. That's why class they have the term adrenergic. Now, let's look at the confusing terms. If I say parasympathomimetic, is it adrenergic or cholinergic?
Cholinergic, sir.
Okay, so class keyword, parasympa, ginmimikya. Okay, mimetic. So overall, the effect will be cholinergic. How about if I say parasympatholytic? Is it cholinergic or adrenergic?
Adrenergic, sir.
Adrenergic.
It would be adrenergic. Okay, in this case, it would be adrenergic. What else? When I say sympathetic or sympathetic, nalipat ko. Okay, sympathetic agonist, what would be the effect? Cholinergic or adrenergic?
Cholinergic, sir.
Cholinergic.
When I say agonist, does it support or does it contradict?
Contradict.
Contradict.
Sige, let's meet the another term, antagonist. So, sinong nagko-contradict? Is it the agonist or the antagonist?
Antagonist, sir. Ang
Okay,
contradict.
antagonist yung
Antagonist.
nagko-contradict. Tama si Slytherin. Okay, so class antagonist. Okay, so this, okay, balik ko sa question. Sympathetic agonist. Is it sympa or parasympa?
Sympa, sir.
Sympa.
The effect will be sympa. It will be adrenergic. How about sympathetic antagonist? What will be the effect?
Cholinergic, sir.
The effect will be cholinergic. Okay? I hope you're getting the point. And what's the purpose of learning that? So for example, they will say that a drug is a sympathetic antagonist. If you will say that a drug is a sympathetic antagonist, what's the major side effect when it comes to heart rate? Will it increase the heart rate or decrease the heart rate?
Decrease, sir.
Yes, sir.
Decrease.
Decrease.
Because you understand that antagonist will have cholinergic effects. Okay? That's why if you can notice when you're learning pharmacology, we are emphasizing first on sympa versus parasympa, and then later on we will tell you what's its effect now. Para you will be able to realize if what are the side effects also of these medications. Okay? Now, let's go to your cute drug, atropine. Parang si atropine ang topic since yesterday. So atropine is mentioned to be a sympa drug. Diba? Your atropine is a very good example of an adrenergic drug. Okay, your sympathetic drug. Now, give me one function of atropine. Give me one function of atropine.
Increase heart rate, sir.
Okay, very good. It increases the heart rate. Okay, meaning if my patient class has sinus bradycardia, okay, I am giving my patient atropine so that the heart rate will increase. Tama? Because if you say bradycardia, it means low heart rate. Now, what do you think will be the side effect of atropine in this case? What will happen to the secretions in the mouth? Will it increase or decrease since sympatia?
Decrease,
Decrease,
sir.
sir.
Reduce, sir. Increase.
It will be, di ba pag sinabi kong sympa, fight or flight response, your patient is also dry. So what would happen to the secretions in the mouth?
Decrease, sir.
Decrease, sir.
Secretions in the mouth would be decreased. So in this case, the side effect is dry mouth. Okay, so you don't need to memorize atropine, dry mouth, because epinephrine would also lead to dry mouth. Norepinephrine would also lead to dry mouth. Okay, because they are all sympathetic medications. Okay, now another example, if my patient class will undergo endoscopy, familiar with endoscopy? Okay, endoscopy, di ba? A scope will be inserted through your mouth, going towards your esophagus, going towards your stomach. My patient was given atropine. What do you think was the purpose? Bakit binigyan si patient undergoing endoscopy by atropine? With atropine. Anong purpose?
Secretion, sir.
Yes, hapal pa?
To decrease secretion, sir.
Very good. The purpose this time is to decrease secretions. Because you don't want saliva when you are doing endoscopy. Okay, we don't want saliva because saliva would increase the risk for
Choking, sir.
Aeration, sir.
okay, very good. Aspiration. Okay, aspiration, I mean. Okay, so it would increase the risk for aspiration. Now, since it is given to decrease the secretions, what's the side effect this time? The side effect this time is your tachycardia or the increase of your heart rate. Kuha, are you getting the point? Okay, so that would mean that, okay, let's go back to a simple pharmacology concept that in your pharma, we have your intended effect or your therapeutic effect. And then you also have what you refer to as your side effect. You also have what you refer to as your adverse effect. Okay? Intended or therapeutic effect, yung gusto natin. Yan yung gusto nating mangyari for our patient. Your side effect is something, okay, is something that is not intended, something that might be uncomfortable. However, do we expect side effects? Are side effects expected? It's expected.
Yes, sir.
Okay? Expected siya. Okay? Expected, pero we do not desire it. Okay? Now, pag sinabi kong adverse effect, is it expected or not expected?
Not, sir.
Not
In this case, class, it's not expected. And then the major thing is that it's life-threatening. Okay? It's considered to be life-threatening. Okay? So, ganun yan. So, if you will be asked, patient undergoing endoscopy given atropine, what's the purpose? It's to decrease secretion. But if it's given to a patient with sinus bradycardia, the purpose was to increase the heart rate. Okay? Meaning, if you will be asked, patient undergoing endoscopy given atropine, what side effect will you monitor? That will be the heart rate of your patient. Okay, that will be the heart rate of your patient. Okay, what else for sympathetic nervous system? Another very good drug there is your epinephrine. If I talk about your epinephrine, it's the drug of choice for
Anaphylactic shock, sir.
Very good. It's a drug of choice for your anaphylactic shock. And when I talk about anaphylactic shock, that refers to your severe allergic reaction. Okay, it refers to your severe allergic reaction. Okay, so class epinephrine is given or is only given hindi na ako marunong mag-spelling. Epinephrine class is given sub-Q or IM for anaphylactic shock. Okay, again, epinephrine is given sub-Q or IM for anaphylactic shock. However, another indication of epinephrine, saan pa siya natin ginagamit? Other than anaphylaxis. Yes,
Arrest.
Very good, cardiac arrest. And in cardiac arrest, what would be the route of administration?
IVTT, sir.
IV, sir.
In this case, it's given IVTT for cardiac arrest. Okay? But remember for anaphylactic shock, even if it is an emergency, we do not give your epinephrine IVTT. Okay? Or else your patient would have a lot of adverse reactions. Okay? So epinephrine, it's drug of choice for anaphylactic shock. What else? Salbutamol. Salbutamol is also a sympathetic drug. Okay? Specifically, it's a beta-2 agonist. It's a beta-2 agonist. Meaning it acts on what part of the body? The lungs or the heart?
Lungs. Lungs, sir.
It acts on the lungs. Okay? So plus just remember when you have your beta-2, okay, your beta-2 would act on the lungs. Okay? Remember there are two B's here. I'm trying to draw your lungs. And then plus when you talk about your heart, okay, your heart would only have one letter B. So it is the beta-1 receptors that acts on the heart. It is the beta-2 receptors that acts on the lungs. Okay? What else? Sige. Now, since as a beta-2 agonist, what's its effect? Does it do your bronchial dilation or bronchial constriction?
Dilation, sir.
Okay, so plus
Dilation, sir.
its effect will be geared towards bronchial dilation. And what will be its side effect? Diba, it's a SIMPA drug. Since it's a SIMPA medication, what will be the effect of your salbutamol when it comes to your heart rate?
Increase, sir.
It will increase your heart rate. Okay, it will increase your heart rate. Okay, sino sa inyo hapoon, di ba na-notice yung ako magpaaso? If your patient would do the pausok, okay, or the nebulization, one complaints that they have is that they will have palpitations. Okay, that is because of the effect to the sympathetic nervous system. Okay, so while you are trying to recall a lot of medications, no, you're trying to recall a lot of medications, try to determine whether the effect is sympathetic or parasympathetic. That way you will be able to understand their side effects. Okay, so as for salbutamol, it will be palpitations. By the way, may major electrolyte na inaapektuhan si salbutamol. What electrolyte is affected by your salbutamol? Sige na. This is something special about salbutamol. So class, your salbutamol is affecting actually your potassium. Okay? Your salbutamol also lowers potassium. Okay? Meaning, pag prolonged use ka ng salbutamol, you would have hypokalemia. Okay? If you have prolonged use of salbutamol, you would have hypokalemia. Okay? And the good thing naman is that if your patient has hyperkalemia can be treated with salbutamol. Okay? You don't need to memorize, no? Basta you understand the salbutamol decreases potassium, you would be able to play on that. Sige. Another. So far, Simpa. Another thing that we need to remember about your sympathetic nervous system is that there are actually 4 receptors. You have your alpha-1, alpha-2, beta-1, and beta-2. So I mentioned earlier that beta-1 acts on the heart. Your beta-2 would act on the lungs. Okay? Now, to expound on that, I would usually tell my student this. Okay? It acts on the lungs. Okay? So the lungs there stands for lung, of course, liver, U is uterus, N is not on the list, your G is it would act on the GI tract, and then your S is your smooth tissues. Okay, smooth tissues. That's where your beta-2 receptors are acting. Your beta-1 receptors is HK or Hong Kong. So that would be your heart and kidney. Heart and kidney. The effect of alpha-1 and alpha-2 receptors are in your blood vessels and your blood volume. But there's something special with your alpha-2. Okay? Diba, guys, when I say sympathetic nervous system, if I will trigger your nervous system, what will again happen to the BP? It will increase. Diba? It will increase, no? Sorry for repeating that, pero I would like to make a point that alpha-2 is an exception. Alpha-2 is an exception to that rule. Okay? Why? You have an example of an alpha-2 agonist. One example is your clonidine. Common brand of clonidine is? Common brand of clonidine is, okay, that will be your catapres. Okay, that will be your catapres. What does catapres do to your blood pressure?
Lowers blood pressure.
Lowers your blood pressure. Okay? Take note ha, agonist na siya. It's an agonist. If I will talk about alpha-1 agonist, yes, it will increase BP. Beta-1 agonist, it might increase BP. Beta-2 agonist, it might also increase BP. However, alpha-2, no, alpha-2 is a separate situation. Alpha-2 agonists, such as your catapres, lowers your blood pressure. Okay? Memory serves me well. Another example under this is your nicardipine. Okay? Your nicardipine, if I'm not mistaken, is also an alpha-2 agonist. Okay, so that's just an exception to the rule. That's why when you're studying in healthcare, you remember the rule and then you try to find out if there's an exception to the rule. Okay, so that it will not be difficult for you. So I think that's it about sympathetic nervous system. Antidote. What's the antidote for your sympathetic drugs? What's the antidote for your sympathetic drugs? Let's say, for example, na-overdose si patient ng atropine. Or let's say, for example, na-overdose si patient ng epinephrine. What's the drug that could be used as an antidote for this? Anybody? P, H, E, N, T. Okay, that will be your phentolamine. Ha? Antidote class for sympathetic medications, that will be your phentolamine. Okay? Oh, pagbalis karon naman ang question, antidote for parasympathetic overdose or parasympathetic drugs. What do you think?
Epinephrine, sir.
We don't commonly use epinephrine as an antidote, pero good thinking on that, we use atropine. Atropine. Okay? Yeah, I appreciate your reasoning on the use of epinephrine. But the common antidote use is atropine. Okay? Bakit? You might be wondering, napakarami kasing adverse reactions with epinephrine. And the impact of epinephrine to the heart is very rapid. No? Kung kaya we are very careful on using your epinephrine. Okay? Now, that's it for your sympa agonist. But we need also to understand that there are sympa antagonists. There are sympa antagonists. And very good example would be your beta blockers. These drugs ends with
Olol, sir.
these are the drugs that ends with olol. So you have, for example, you have your propanolol, then you have your timolol. Okay, so they are beta blockers. Since they are beta blockers, what does they do with the BP? Blocker.
Lowers.
It will lower
BP,
down your
Lowers.
BP. Okay, it lower down your BP. That's why when you give, if your patient is hypertensive, the maintenance commonly is olol, olol, olol. Okay, but question, is it okay to give beta blockers? Is it okay to give beta blockers to COPD patients, to asthmatic patients?
No, sir.
Okay, bakit no? Sige, bakit no? Because if you will block the beta, what particular organ will be blocked?
Lungs, sir.
The lungs. No?
Lungs,
So,
sir.
beta-2 blockade would lead to lung problem. Okay? That's why for COPD and asthmatic, we need to be cautious. Okay, we need to be cautious. Okay, hindi man no, hindi man nga no get, pero cautious lang. And then for COPD and asthmatic, what we use is your selective beta-1 blockers. Okay, so we have your selective beta-1 blockers. In other words, it does not block both the beta-1 and beta-2. It would only block beta-1. Okay? Bawal tayo, okay? We do not give your non-selective beta blockers to your COPD and asthmatic because it blocks both beta-1 and beta-2. Gets ni Coco Brain? Okay? Sige. So, mo lang na ha, pag COPD kag asthma, because we want to take care of the lungs, we only block the beta-1. Just like your COX-2 inhibitor. Diba? If we want to take care of the stomach, we only block the COX-2. We would want the COX-1 to keep on functioning. The same thing here. We just block the beta-1 to decrease the BP. We do not block beta-2 so that the lungs will still function. Okay? What else? Sige, that's your beta blockers. Later, I hope we can touch on the antihypertensives. Now, let's talk about your parasympathetic medications. Okay, so they will be your cholinergic medications. They will be your cholinergic medications. One classic drug under there is your bethanicol. Bethanicol is the drug of choice for bethanicol. It's the drug of choice for subong nyo lang na-meet si bethanicol. Okay lang guys, kung if I'm not teaching pharma, I will not be able to memorize this also. Bethanicol is the drug of choice for urinary retention. Okay, drug of choice for urinary retention. In other words, what will it do? Will it excrete the urine or will it hold the urine?
Excrete, sir.
Okay, it will excrete the urine. Okay, but question, can I give this to a patient with urethra? Can I give this to a patient with stones, with urinary stones, blocking the urethra? What do you think? Bethanicol,
No,
can it
sir.
help a patient with stones in the urethra? So if you would look at the anatomy, let me try to search here in Google, bladder and urethra. Okay, where's that? It's not loading well. Okay, if you would look at the anatomy, let's paste it here. So guys, if you would look at the anatomy, no? Okay, yan kasi nag-automatic design. Okay, yan. Plus, if your patient has a stone dislodged in the urethra, and then you will give bethanicol, bethanicol would push the bladder. It would make the bladder contract to push out the urine. Will it be okay if my patient has stones here? Okay lang? No, because it will
No,
injure
sir.
your urethra. It will injure your urethra. Okay? So class, your urinary stones is the contraindication for the administration of your bethanicol. Okay, your urinary stones is the contraindication for the administration of your bethanicol. Ayas? Sige. Next example of the drug, let me look at my list. You have your metoclopramide. Metoclopramide. What's the common function of your metoclopramide?
Antiemetic, sir.
Antiemetic. Okay, antiemetic. So class, why is it considered cholinergic? When I say cholinergic, what does it do with your GI movement? Does it increase it or decrease it?
Increase, sir.
Increase. Okay, increase. So paano class na yung metoclopramide cholinergic at saka antiemetic? So what does it do? 'Di ba antiemetic, nasusuka ka. So bibigyan ka ng antiemetic. How does it work? It will make the movement of your GI a little bit faster so that hindi mo siya isusuka, ilalabas mo siya doon sa papunta sa puwet mo. Getting the point? Okay? So it increases the movement of your GI to avoid the reflux, avoid going back, but instead for the GI to flow going towards your intestines. Okay? So that the normal body physiology would go on. Okay? That's how your antiemetic metoclopramide works. What else? Pilocarpine. Pilocarpine is also a cholinergic drug. Its effect is specific to what organ of the body? Yung organ ng body na affected by increased IOP.
I, sir, I.
Okay. So plus the effect of your pilocarpine is on the eyes. Okay? Meaning, what does it do? Since cholinergic siya, is it a mydriatic or a meiotic?
Meiotic, sir.
Meiotic,
It's
sir.
a meiotic. In other words, does it dilate the pupils or constrict the pupils?
Constrict.
Constrict.
Strict.
It constricts your pupils. And what is this condition na increase yung IOP?
Glaucoma.
Very good. So meaning class, your pilocarpine is your drug of choice for your glaucoma. Okay? Pilocarpine is among the drug of choice for glaucoma. Two types of glaucoma, acute and chronic, which is an emergency. Sino yung emergency sa dalawa? Si acute glaucoma or si chronic glaucoma?
Acute, sir.
Okay? Plus, in any condition that we have, no? In any conditions that we have, basta acute, siya yung emergency. Okay? Basta acute, siya yung emergency. Okay? What else? Tensilon. Can you recall what's tensilon? Tensilon. I believe tensilon is cholinergic. Eh. May generic yan. What's the generic name of tensilon? Ako yung nagle-lecture, ako yung hindi makarecall. Ano? Okay? Pyridostigmine. Let me see. Are you familiar of tensilon? Have you heard of tensilon? Wala. Okay, ako nga rin eh.
No.
Sinesearch ko nga sa Google. Okay? Sige, class. Another example of your drugs under your cholinergic is that you have your physostigmine, you have your neostigmine, you also have your pyridostigmine. Okay? Don't memorize. Mauubusan kayo ng brain cells. Just memorize the stigmine, stigmine, stigmine. Okay, those are your cholinergic drugs. And these are actually your drug of choice for what condition? These are your drug of choice for what condition? Have you heard of MG?
Yes, sir.
Okay,
Yes,
what's MG? What's MG?
Myasthenia gravis.
That's your myasthenia gravis. Okay, that's your myasthenia gravis. So your physostigmine, neostigmine, and pyridostigmine is your drug of choice for your myasthenia gravis. Okay? Now, for us to understand how does that happen, what's the problem in myasthenia gravis? What's the problem in myasthenia gravis? Let me try to look for a picture for myasthenia gravis. Sige na, anong problema sa myasthenia gravis? Did you have your neuro already? That's MS2, right?
Yes, sir.
Okay, so anong problema kay myasthenia gravis?
Weakness, sir.
Weakness. Okay.
Muscle weaknesses, sir.
Okay, so let's go to the pathophase. Yan, automatic na naman. Hindi siya makontento kung saan sila nilalagay. Okay, so class, myasthenia gravis. Your main problem in myasthenia gravis, dear future nurses, is that there is decrease of acetylcholine. One of your main problems in myasthenia gravis is that there's a decrease of acetylcholine. Why? What happens? In the picture class, you are seeing a neuromuscular junction. So on your left is normal. In myasthenia gravis, this is what's happening. Class, the acetylcholine, look at the small dots here, the acetylcholine could not go to their receptor sites because the antibodies are blocking the receptor sites. Okay, the antibodies class are blocking the receptor sites. Meaning, when I talk about your myasthenia gravis is an autoimmune disease. Okay? Bakit autoimmune? Because the immune system, it's as if that the immune system is attacking the receptor sites. Okay? Mas madumduman ang receptor sites. When I say receptor sites, it's like your lock and key model. So, if this is acetylcholine, we know acetylcholine would help on our muscles. But if your acetylcholine could not attach to the receptor site, useless. Okay, so dapat acetylcholine will be able to attach to the receptor site so that it can work our muscles out. It can help our muscles. In this case, in myasthenia gravis, the receptor sites is actually occupied. Okay? Inoccupy siya ng mga antibodies ng katawan natin. That's why it's autoimmune. And if you would look at the physiology or the pathophysiology of your myasthenia gravis, It's because of the it's because of the decreased acetylcholine. Okay, it's because of the decreased acetylcholine due to the destruction of the receptor sites. Kuha? That's why, sabi kanina ni Hufflepuff, which is difficult to pronounce, okay, your myasthenia gravis would have weakness. Diba? Yun yung common sign ng myasthenia gravis. Let me see if there's a picture here of myasthenia gravis. Okay? So, yung signs and symptoms niyan, class, is nagkakaroon ng weakness yung pasyente natin. Okay, sana nga ba yun? Wala akong picture dito eh. Okay? There will be drooping of the eyelids. What else? Ayan, ayan, ayan. Here. Okay, so this is how a patient with myasthenia gravis would look. Okay, so your patient would have the weakness. Okay, what else? Let me check other pictures so that it would paint a picture to your brain. This is how a patient with myasthenia gravis would look. Okay, so since we are discussing parasympathetic medications, di ba? Parasimpa, ano ang ini-increase ni parasimpa drugs? What particular neurotransmitter?
Acetylcholine.
Okay, so that's why, class, your drug of choice for the management of your myasthenia gravis is your parasympathetic medications. Because the goal is to increase the available acetylcholine. Okay? And then other than that, class, we have the term acetylcholinesterase. Acetylcholinesterase. Okay? Check spelling. If I'm saying cholinesterase, what do you think does it do to our acetylcholine? Esterase. Will it increase the acetylcholine or decrease the acetylcholine? Sige na, acetylcholinesterase. Palagay nyo, anong ginagawa? Will it increase acetylcholine or decrease acetylcholine?
Increase, sir.
Esterase. Esterase. When I say lipase, when I say amylase, what are they?
Enzymes, sir.
They are enzymes. And what do enzymes do? Does it build up or break down?
Breakdown.
Break down. Huh? So acetylcholinesterase is also breaking down your acetylcholine. Meaning, ang effect ng acetylcholinesterase is that it would decrease the acetylcholine levels. And do I want this to happen in myasthenia gravis?
No.
Gusto ko to? No, I don't want this in myasthenia gravis. That's why another drug of choice for myasthenia gravis is your acetylcholinesterase. Mahirap talaga mag-spelling bee. Acetylcholinesterase inhibitors. Okay? One of the drugs that we give for your myasthenia gravis is acetylcholinesterase inhibitor. Kuha? Okay? If you would understand it in English, acetylcholinesterase, it breaks down acetylcholine. Now, this time, let's inhibit it. And the goal of that is to increase your acetylcholine. Gets? Okay, so that's your myasthenia gravis, its pathophysiology, and then the drugs that are used to it. Now, okay, so mga drugs ini is the one that I mentioned earlier. So you have your physostigmine, you have your stigmine, your pyridostigmine, and then you have your neostigmine. Okay? Pero ang main hugot ko kanina was just coming from the tensilon. Okay, your tensilon is actually generic name is edrophonium. Edrophonium chloride. Okay, so class, the generic name of your tensilon is edrophonium chloride. Okay, let me search. Okay, your edrophonium. Okay, tama. Okay, so class, your edrophonium chloride is a short-acting, okay, it's a short-acting cholinergic drug. It's a short-acting cholinergic drug. And the tensilon test is the diagnostic test. Diagnostic test for myasthenia gravis. Okay? So, anong kakatabo when you're doing the tensilon test? Class, when we do the tensilon test, let me see. Okay? I do tensilon test to check if my patient has myasthenia gravis or not. Okay, I'm doing your tensilon test to check whether my patient has myasthenia gravis or not. So pag sulod na nila sa ER class, aring itsura nila ang sa left side of the screen. Okay? So your patient would have muscle weakness, your patient would have facial asymmetry. So if you are suspecting myasthenia gravis, the doctor will order for tensilon test. So what's tensilon test? The drug is administered IV. Okay, tensilon will be administered IV. Pag myasthenia gravis si patient mo, your patient will have the resolution of the signs and symptoms after you gave tensilon. Okay, after you gave tensilon, the signs and symptoms will be okay. Okay, so instead of muscle weakness here on the left side, ma-okay siya, mapareho ni siya sa right side. Okay, now if you will use your Coco brain to analyze it, our problem in myasthenia gravis is that kulang si acetylcholine. Dahil kulang si acetylcholine, nagka-muscle weakness. This time, I gave tensilon. Tensilon is a cholinergic drug. What will it do to acetylcholine? Will it increase it or decrease it?
Increase.
Increase.
Increase. Since na-increase na si acetylcholine, okay si muscles. But again, I mentioned it's a short-acting drug, meaning, can I use it to cure my patient's condition? Can I use it to manage my patient's condition? And of course, no. Okay? Or else plus
No.
every 3 minutes or every 5 minutes, nag-i-inject ka ng tensilon. Okay? So no, it's not used class for the management. Instead, it's just used for the diagnosis of your myasthenia gravis. Okay? Now, since my patient is undergoing tensilon test, there is a risk that her heart will be affected. What drug will I have on standby as an antidote for your tensilon?
Atropine, sir.
Very good. That will still go back to your atropine. Okay? Kuha. Ha? Tiga balik-balik lang istorya, no? Dito man gyapon siya balik kay atropine. Okay? So that's an example of your tawag cholinergic medications. Okay, what else? I have here an acronym that says about the effects of cholinergic medications. I think this is wise to be shared to you. Okay, other than thinking that cholinergic is wet, this might be your secondary backup. So you have your sludge. Sludge stands for salivation, lacrimation, urinary incontinence. Okay, then you have diarrhea, you have GI cramps, and then you have emesis. These are the effects of your cholinergic medications. Okay? If you look at it, it goes back to wet. Saliva, kalalaway, wet. Lacrimation, lumuluha, wet. Urinary incontinence. Pag sinabi kong incontinence, those are patients who would say na, uy, hindi ako makaabot sa CR. Lumabas na yung ihi ko. Okay? Diarrhea, it's wet. GI cramps. When I say GI cramps, it's increased peristalsis. And increased peristalsis would also lead to your diarrhea. Okay? Emesis. What's emesis? Okay, emesis is also pagsusuka. Okay, pagsusuka. Okay, so those are the possible effects if you will have overdosage of your cholinergic medications. Okay, so you have the term sludge. Okay, sige. Okay, so far, can you capture the discussion?
Yes, sir.
Sige. Next, what time is it? Okay, we are down to about 1 hour. Kerry? It's 1 hour. Let's have a 5-minute break. Okay, so the next drug is insulin. If you can recall our discussion, so when I say insulin, it's the drug of choice for your type 1 diabetes mellitus. It's also used for type 2 diabetes mellitus, which is uncontrolled. Now, if your patient with type 2 diabetes mellitus is admitted in the hospital and will undergo surgery, what do you think is best to be given to the patient? Will you still give OHA or insulin?
Insulin, sir.
Okay, in
Insulin.
this case, guys, we use insulin because the effect of insulin is more predictable compared to the effect of your OHA, especially if your patient is already prepared for surgery. Okay? Now, let's talk about insulin. We mentioned that insulin is given sub-Q, and the only insulin that could be given IV is what type of insulin?
Regular, sir.
That will be your regular insulin. Now, when is the best time to inject your insulin? A, is it 30 minutes before meals? B, when the food is already in front of the patient? Or C, after meals? Or D, none of the above? Is it A, B, or C? When is the best time to administer your insulin? A, B, or C? Multiple choice, guys. Anong tip? The longest option is usually the answer. Di ba? Okay? With that, what's the answer? Guys, your answer here is letter B. When the food is in front of the patient. What's the purpose? It would prevent your hypoglycemia. This is intended to prevent your hypoglycemia. Kuha? Okay? Now, if letter B is not in the choices, the next answer that you would get is letter A. The next answer that you would get is letter A. That is again to prevent hypoglycemia. But the best answer is letter B, when the food is already in front of the patient. Okay? So, why guys? By the time kasi that you would inject insulin, especially regular insulin, its peak action will be in 30 minutes to 1 hour. Its peak action will be in 30 minutes to 1 hour. Meaning, if naghatag ako insulin, if nagbigay ako ng insulin, pagkatapos, walang kinain si patient, the tendency is that the patient will become hypoglycemic. Okay? Give me signs and symptoms of hypoglycemia. Give me signs and symptoms of hypoglycemia. Go ahead.
Tremor, sir.
Tremors. Yes. What else? Ravenclaw, you're about to say something. What else, class? Sige na. If you are hypoglycemic, what are the signs and symptoms that you will be experiencing? Try ko kung may mnemonic sila. Okay. Sometimes, in cases like this, what I'm actually doing is I'm searching in the internet, hypoglycemia, mnemonic. Okay, because that could help you in your study. Okay. Oh, this one is nice. Look. I will share it here. The mnemonic is, he is tired. He as in headache. I as in irritable and sweating. Tachycardic, irritable, restlessness, excessive hunger, and dizziness. Those are all signs of hypoglycemia. So your patient, he is tired. Okay? Maybe you can use that. You can use that to remember this one. Okay, those are all signs of hypoglycemia. And if my patient is experiencing hypoglycemia, what is the drug of choice? What is the drug of choice? Yes, Hufflepuff.
Sugar, sir.
Ravenclaw, you're about to say something?
Simple sugars.
Okay, so you can have class your simple sugar. You can also prepare your glucagon injections. And for severe cases, you can prepare your D50. You have your dextrose 50. Okay, glucagon may be given IM. Your dextrose 50 may be given IVTP. Okay, so those are the management for your hypoglycemia. So meaning, if you will be asked what's the antidote of insulin, these are also the answers. Okay, so you have your glucagon and your D50. Okay, what else about insulin? I think those are the important concepts for insulin. Thyroid drugs, let's just touch on that later on. Okay, let's go to iron first. Iron, there's a special consideration for iron. What does iron do first? We give iron in what diseases?
Anemia, sir.
Anemia. Best time of the day to take iron? Yes, Gryffindor.
For meals.
Okay, before meals. What else? Other than before meals, AM, morning, or evening? AM or morning? Do pareho mo lang. Morning or evening? One effect of your iron is that your iron causes dizziness. Your iron causes feelings of being sleepy. So when is the best time of the day to take your iron? Is it in the morning or in the evening?
Evenings.
Best to be given in the evening. Okay? Now, what else? Is it okay to give iron syrup to pediatrics? Is it okay to give iron syrup for pediatrics?
Yes, sir.
Yes, it's okay. But one consideration that you need to remember is what happens if a
Yes.
child would take iron? Again, Ravenclaw.
May stain sa teeth, sir.
Very good. Okay, it causes teeth staining. It makes the teeth yellowish. So, what will be your nursing intervention? Bata is taking iron. What would you do? Will you change it to oral or to tablet form, or you will use something? Sige na. Kasimple na sa intervention niya. To prevent staining of the teeth, what would you do when you are giving iron? You administer it with straw. You administer it with straw. Kuha. Okay? Para lang class maiwasan ang teeth kag diretso tulon. Okay? It's particular in pediatrics because or else class there will be staining of your teeth. Okay? May vitamins yata mo. What vitamins is given to facilitate the absorption of iron? What
Vitamin
vitamin?
C, sir.
Okay, tama gid man, vitamin C. Okay, I was trying to search it. No? So vitamin C, so meaning you can administer iron with your orange juice. Okay, oftentimes the intervention would say administer iron with orange juice, and the purpose of that is to facilitate the absorption of your iron. Okay, on the side, what particular vitamins is needed to facilitate calcium absorption?
Vitamin D.
Okay, in this case naman yung classic calcium, it is the vitamin D that helps in your calcium absorption. Okay, that's one thing that you need to remember. Sige, so that's it for your iron. Magnesium, your magnesium is also an electrolyte. Okay, and in particular, one drug that is very good example for that contains magnesium is your magnesium sulfate. It is a drug of choice for a particular OB condition. What OB condition is that? Magnesium sulfate, drug of choice for what particular obstetric condition would use your magnesium sulfate? Sige, it's the condition wherein the patient is experiencing increased BP, the patient is experiencing protein in the urine, and then your patient is experiencing seizure episodes or convulsions.
HELP syndrome, sir.
Again,
HELP syndrome.
gusto mo yung mga HELP syndrome. Gusto mo yung mga hemolysis, elevated liver. Ano ganing meaning sang HELP? Okay, help me please. Hemolysis. Double L na, di ba? Okay, sige, let me search so that I can refresh my brains also. Okay, help me.
Liver and
Yes, elevated liver enzymes. What's the another L? Low platelet. Okay, that's not it, ha? That's not it. I'm just interested on the meaning. Kaya nalipat na.
Eclampsia, sir.
Very good. That will be your eclampsia. Okay? So guys, your magnesium sulfate is the drug of choice for eclampsia. It's the drug of choice for eclampsia. Okay, simple recall. You have the condition referred to as preeclampsia. You also have the condition referred to as eclampsia. What's the main difference between pre-ec and ec? What's the main difference between your preeclamptic patient and your eclamptic patients? Sorbelan mo online class kaya nga mo MCN. Wala gamit yung sir ka pamati. The main difference guys is the presence of your convulsions. Okay, the main difference is the presence of your convulsions. In your pregnancy or your preeclampsia, oftentimes we use this interchangeably with the term PIH. Okay, PIH is pregnancy-induced hypertension. Pregnancy-induced hypertension. Meaning the patient is having increased BP and then your patient is also having proteinuria. Okay, your patient is having increased BP and proteinuria. Pero in eclampsia, your patient is already having convulsions. Okay, may add-on na siya class nga convulsion. And the drug of choice for that is your magnesium sulfate. Meaning, is magnesium a neurodepressant or a neurostimulant? If it can help
Depressant.
with convulsion, very good. It's a neurodepressant. Okay? Meaning class, your magnesium sulfate is considered to be bakit lumipat? Your MagSul, okay, your MgSO4 is actually a neurodepressant. Okay? Lagay lang sa Coco Brain, magnesium sulfate, drug of choice for eclampsia. Eclampsia has convulsions. Since it can manage convulsion, meaning it's a neurodepressant. Okay? Remind me to discuss burp later on, but let's go back to the pathophysio first of pregnancy-induced hypertension. Okay? Class, when I say PIH, what week of pregnancy does it commonly develop? What week of pregnancy? Again?
20.
Okay, very good. No kanami lang no kay gaduwa-duwa ko sa answer sa brain ko, but you are confirming it. So thank you for that. So class, pregnancy-induced hypertension is common among 20 weeks and above. Okay, 20 weeks and above. If you would look at 20 weeks, how many months of pregnancy is that already? How many months of pregnancy is that? That will be already on the 5th month of pregnancy. Na? 5th month of pregnancy. Meaning class, it's already on the 2nd trimester. Okay? If you will be going back to OB, try to remember what are the complications in the 1st trimester, the complications in the 2nd trim, and the 3rd trim. Because if you're answering the questions, it's important for you to know the age of gestation. For example, 1st trimester, the patient is bleeding. It could be because of miscarriage. It could be because of H-mole, okay? Something like that. On the 3rd trimester, if the patient is bleeding, it might be because already of placenta previa or abruptio placenta. Okay? Katig-agi ang placenta. Okay, so that's it. But anyway, preeclampsia is on the 2nd trimester. And class, your patient is having increased BP and proteinuria. When I say protein, dear students, what's the purpose of protein in our body? What's the purpose of protein, especially in blood volume? Yes, Ravenclaw, go ahead. Ano daw yung purpose? Sige na. Or can you name an important protein muna that our body needs? Can you name that important protein that our body needs?
Albumin, sir.
That will be albumin.
Albumin, sir.
Very good. Albumin maintains a very important pressure in our bloodstream. And what do you call that pressure?
Intracellular, sir.
Intracellular. What else? Starts with letter O. O, pressure O. What pressure does your albumin maintains? Sige na. This is fluids and electrolytes. What important pressure that does your albumin maintain? So we are connecting the discussion from protein. Remember that one example of protein is your albumin. Albumin maintains an important pressure, and that is your osmotic pressure. Okay, your albumin maintains what we refer to as your osmotic pressure. Now, pag-usapan natin si osmotic pressure using my very nice drawing. Okay, so class, that is a blood vessel. Wala ba itong thicker blood vessel? Saan ba yung pa-thicker nito? No. Okay, so this is your blood vessel, class. Now, if this is your blood vessel, the purpose of your osmotic pressure is to maintain the fluid inside the blood vessel. Okay, ito yung class yung osmotic pressure nyo ha. Mga arrow na ha, hindi na sperm. Okay, those are arrows. Okay, indicating that it maintains your osmotic pressure to maintain the fluid inside the blood vessel. Okay, it will maintain the fluid inside the blood vessel. Gets? Kuha? Okay. Now, since my patient is having proteinuria, this time my patient is having proteinuria. Meaning class, pag proteinuria, anong nangyayari class sa ating protein? Is it staying in the blood or is it going out to the urine? Okay, it goes out to your urine. No? The protein class is leaking in the urine. Meaning, what happens to the protein in the bloodstream? Is it increase or decrease?
Decrease, sir.
Protein levels in the bloodstream is decrease. Since the protein levels in the bloodstream, dear future nurses, is decreased, what would happen to the fluids? Will it stay inside the blood vessel or will it leak out?
Dic
Leak out, sir.
Okay? So class, since mababa yung albumin, since mababa yung osmotic pressure, the tendency is that the blood vessels would have leaking out of fluids. And what particular sign and symptom your patient would manifest?
edema, sir.
That's why your patient class with pregnancy-induced hypertension having proteinuria would have edema. Okay? Kuha? Can you follow through? Okay, so that's why one sign and symptom of your patient class who is manifesting your PIH would also be edema. And that is not only true in edema, that will be true also among your patients with hypoalbuminemia. That would be true also among your patients with hypoalbuminemia. That will be true among your patients with GI problems wherein the albumin cannot be absorbed. That will also be true among your patients with liver problems. So, halos lahat nating patients na nagkaka-edema would have a problem with your protein, okay, or your proteinuria. Okay? And the same thing, class, your patient is also having hypertension. Bakit hypertension? Fluid keeps on leaking out, and then the patient class feels na he is thirsty, she is thirsty, she keeps on drinking water, and because of that, there will be increased fluid inside the body. Okay? Increase lang yung fluid sa katawan, nag-i-increase din yung blood pressure natin. Okay? That's why your patient is having these signs and symptoms. So what else? So eclampsia, ha? Once your patient is having convulsions, your drug of choice is magnesium sulfate. Okay, let's talk about the burp. Class, magnesium sulfate is a high alert medication. Meaning, if I will administer it, okay lang ba na ako lang or kailangan i-counter-check ng isang nurse?
Counter-check, sir.
Okay, there should be counter-checking of another nurse. And since it is a high alert medication, we call it HAM, okay, there is an antidote that needs to be prepared. What's the antidote of your magnesium?
Calcium gluconate, sir.
Very good. The antidote is your calcium gluconate. Calcium gluconate. Now, if you would study electrolytes, look at the relationship of magnesium and calcium. The relationship, class, is that they are enemies. The relationship is said to be inverse. So if you would study electrolytes, you would notice that the signs and symptoms of hypomagnesemia is almost the same with the signs and symptoms of hypercalcemia. Okay, try to look later on. And the signs and symptoms of hypercalcemia is the same as the signs and symptoms of hypomagnesemia. In the same way, if you are studying potassium and sodium, the signs and symptoms of hypokalemia is the same as the signs and symptoms of hypernatremia. Okay, remember that so that you will not memorize everything. Okay, now what else? Burp. Plus, burp is a reminder of what are the things that you need to check prior to magnesium administration. Okay, the things that you need to check prior to magnesium administration. And B stands for blood pressure. U stands for urine output. R stands for respiratory rate. And P stands for, ano nga ba yung P? Anybody who can tell me what's P? It's not pulse. P is patellar reflex. P is patellar reflex, or your deep tendon reflexes. Okay? 1, why do I need to check blood pressure? What's the side effect of your potassium? Of your magnesium, I mean?
Lower.
Okay? It will lead to hypotension. So, if the BP is low, do not give your magnesium. Okay? Urine output. I am checking the functioning of what organ? I'm checking the functioning of what organ? Yes?
Kidney, sir.
Okay, functioning of kidney. Why? Your magnesium is primarily excreted through the kidney. Okay, primarily excreted through the kidney. Meaning, pag mababa yung urine output, hindi nagfa-function si kidney, do not give magnesium or else your patient would have magnesium toxicity. Okay, your patient would have magnesium toxicity. Now, respiratory rate. Since neurodepressant siya, class, it's also a respiratory depressant. So if RR is less than 12, will I give magnesium? you need to hold your magnesium administration. Okay? Patellar reflex. Remember, your deep tendon reflexes. Your deep tendon reflexes is also an indication of your neurofunction. Okay? That's why, if depress yung DTR, pag 1 plus or 2 plus lang yung DTR, do not give your magnesium. Okay? Let me check the deep tendon reflexes grading. It's 0, 1 plus, 2 plus. Let me check. Okay. So 0. Excuse me. Okay, sorry. 1 plus lang pala yung consider na decrease. 2 plus is already considered to be normal. 3 plus is also normal. 4 plus is already hyperactive. So hyporeflexia is 1 plus. Do not give magnesium because it signals neurodepression. Okay, it signals neurodepression. Okay, can you get the point on that? Sige, so that's the story about your magnesium. Now, another drug on the list that may be of interest is your aluminum. Okay, so you have your aluminum hydroxide. And what's the other one, gani? Aluminum hydroxide and duha ni sila magnesium. Okay, so you have your magnesium hydroxide and aluminum hydroxide. Plus, when I say hydroxide, when kaya natin binibigay yung hydroxide? In what conditions? Sige na, hydroxide. If you would look at chem, hydroxide would emphasize base. Di ba base siya, based on chemistry? Yes. So in what conditions natin siya binibigay?
Metabolic acidosis.
Okay? Acid. Okay? Hindi pa gid nga acidosis, but we give this in acidic conditions. Okay? So guys, your magnesium hydroxide and aluminum hydroxide are actually antacids. And we are using this in the management of ulcer. Diba? Sa ulcer, marami tayong acid. So we give your magnesium hydroxide and aluminum hydroxide. They are antacids and their role is to neutralize the acid. Okay? Diba in chemistry, when you talk about acids, one example is hydrochloric acid. Your hydrochloric acid would have the H or the hydrogen ions. Can you recall that in chem? However, class, when I talk about hydroxide, your hydroxide is a negatively charged ion. So, negative siya, class, it's considered to be basic. Okay, it's basic. Hydroxide is basic. Now, why are we combining? I don't know if you've heard Malox. I don't know if you've seen Malox in the pharmacy. Diba, class, may Malox tayo. Malox is a combination of your magnesium and aluminum hydroxide. So, why are we combining them? Because class of MD and the AC. What do I mean by MD? Magnesium leads to diarrhea.
Diarrhea.
Very good. Your aluminum leads
Aluminum.
to
Constipation.
Okay? So we combine them in such a way that the diarrhea and constipation will even out each other. Okay? Para mawala yung diarrhea at saka constipation, kinumbine natin silang dalawa. Kaya you would notice brands such as Malox combining your magnesium hydroxide and aluminum hydroxide. Okay? That's one important thing that I need to remind on that. Sige. What else? Another there on the list is your AU. Okay? Yeah, your gold. Okay, your gold has some pharmacologic value. Hindi lang some. In fact, malaki yung value niya because it's used for the management of rheumatoid conditions. Okay, it's used for the management of rheumatoid conditions. In other words, class, your gold is used for the management also of autoimmune conditions. Okay, so pag may mga rheumatic problems yung pasyente, okay, we use gold in the management of it. Okay, I just searched here in Google. If you can see, in the 20th century, the observation of injectable gold compounds were successful for the treatment of rheumatoid arthritis. So it's used for your rheumatic conditions. And when you hear rheuma, just think that it's autoimmune. Okay, it's also an autoimmune problem. meaning it's our cells attacking ourselves also. Okay, what else? Next drug there of importance is your penicillin. What's the classification of penicillin?
Antibiotics, sir.
Antibiotic, sir.
It's an antibiotic. Okay, it's an antibiotic. It's in fact among the first antibiotics now which were made. And for your penicillin, just remember that it has cross sensitivity with cephalosporins. In other words, if your patient is allergic to penicillin, the tendency is that your patient will also be allergic to cefalexin. Your patient will also be allergic to cefuroxime. Okay, so they have cross sensitivity. Okay, they have cross sensitivity. Okay, so in a while, that's your penicillin. There are a lot of examples under penicillin. So for your penicillin, one example is that you have your amoxicillin. Okay, then you also have your cloxacillin. Basically, they are drugs that ends with silin. Okay, they are drugs that ends with silin. Okay, so penicillin, amoxicillin, cloxacillin, they are all silins. And just remember antibiotic. And before you administer any antibiotic, what's your nursing responsibility? Check for?
Skin test.
Yes.
Allergic reaction, sir.
Very good. Check for allergic reaction. Ravenclaw, you mentioned about skin test. Okay, so check for allergic reaction and skin test. Okay, how many minutes before I can read the skin test?
30.
30.
Okay, your skin test could be read in 30 minutes. Okay, 30 minutes for that matter. Okay, let's go first to for the laws. I hope you will be able to memorize laws and try to memorize also the new laws for jurisprudence. Like your Republic Act 11028. Is it really nursing? Let me check. Let me check what is RA 11028. I know it's not. Basta try to memorize the Universal Healthcare Law, try to memorize the Mental Health Act, try to memorize the Expanded Breastfeeding Act. Those are new laws now that are being enacted. Universal Healthcare Law, as I just searched, is 11223. Okay, it's 11223. It's the Universal Healthcare Act. For the pharma-related laws, familiarize yourselves with it. But I'll touch first on pharmacokinetics and pharmacodynamics. Okay, pharmacokinetics and pharmacodynamics. Okay? Pharmacokinetics and pharmacodynamics are what your drugs are undergoing when they will enter our body. Okay, this is what your drugs are undergoing when they will enter our body. To differentiate the two of them, okay, when you say what the body does to the drug, what is that? Is it pharmacokinetics or pharmacodynamics?
Pharmacodynamic.
What the body does to the drug, is it pharmacokinetics or pharmacodynamics?
Dynamics.
Sure. Parang ako yung na-confuse. In a while. Okay. So class, when I say what the body does to the drug, this is your pharmacokinetics. Okay? Kung ano yung ginagawa ng katawan sa drug by the time the drug enters, that's your pharmacokinetics. It has 5 steps. In others, it's 4. It's summarized by LADME. Okay? LADME are the 5 steps in your pharmacokinetics. What the drug does to the body is your pharmacodynamics. Okay? What the drug does to your body is your pharmacodynamics. Okay? So, if I will ask you the question, it refers to the effects of the drugs, to the physiology of the body. What are we studying? Pharmacodynamics or pharmacokinetics?
Dynamics.
Okay, very good.
Dynamics,
this one
sir.
refers to your dynamics. Okay, this one refers to your dynamics. Now, let's touch on LADME. LADME, remember, is pharmacokinetics. LADME is pharmacokinetics. L stands for liberation.
Liberation.
A stands for absorption. D stands for distribution. M stands for metabolism. and then excretion. Liberation class, it's just like if it's a tablet, our body will make it a liquid because liquid is faster to be absorbed. Okay? That's liberation. Okay? It's basically, kumbaga, ginpudpod ang tablet. Okay? Ginpudpod sang aton nga GI system or ginliquefy sang aton nga GI system for easy absorption. That's your liberation. Absorption. What's the organ of absorption?
Small intestine, sir.
Very good. That will be your small intestines. What's the organ of distribution?
Blood, sir.
Very good. That will be your blood and your blood vessels. What's the organ of metabolism?
Liver,
Liver,
sir.
sir.
That will be your liver. And what's the organ of excretion? That will be your kidney. Okay? Meaning, if any of these organs are affected, drug absorption will also be affected. For example, hindi gumagana si small intestine, drug will not be absorbed. If there is decreased blood, drug will not be effective. If the liver is not functioning, there is a tendency of toxicity. If the kidney is not functioning, there's also a tendency of toxicity. Just as a short recall, when I talk about the liver, you mainly check liver with SGPT and SGOT. And you check the kidney with your BUN and your creatinine. Okay, those are the laboratory tests for that. Okay, what else? What do you call the effect that happens by the time that the drug passes to the liver? If the drug will pass through the liver, the bioavailability of the drug is decreased. What do you call this effect?
Hepatic first pass, sir.
Very good. That is your hepatic first pass, or we commonly refer to that as your first pass effect. Okay? So plus what happens? If paracetamol will pass through the liver, if you've taken 500 milligrams of paracetamol, by the time that it will pass through the liver, it might become 250 milligrams already. Okay? That is what you refer to as your hepatic first pass effect. Okay? And what route of administration prevents your hepatic first pass? What route of administration prevents your
IV.
hepatic first pass? Very good, Ravenclaw. That will be your IV administration. Okay, your IV administration class bypasses your hepatic first pass effect. Okay? That's why you might be wondering, why are there drugs given IV? Because of the first pass effect. May mga drugs kasi class na kapag oral mo iti-take, by the time it will pass through the liver, it's as good as zero already. So that's why we give your hepatic first pass. Or that's why we give your drugs IV. So, which is faster to effect? Is it the oral drug or the IV medications?
IV.
IV, sir.
IV. Because your IV will not anymore go through the liberation. It will not go anymore with absorption, but it would right away proceed with distribution. Okay, IV class will right away go with distribution. Okay, it is also able to bypass your hepatic first pass effect. No? That's why mas increase ang levels of availability in the bloodstream. Okay, that's it for your pharmacokinetics. What else do I need to remind you of? If my patient has liver cirrhosis, what do you think will be done by the doctor? Will it be to increase the drug or decrease the drug dose? If my patient has liver cirrhosis or let's say, for example, kidney failure, what do you think is best for them? Increase the dose of the medicines or decrease the dose of the medicines?
Decrease, sir.
Okay, so guys, what we do is that we decrease the dose of your medicines. Bakit? If you will increase it, there will be increased risk for toxicity. Okay? Hindi gumagana si liver. In other words, hindi marireduce ni liver kung ano yung amount ng medications. Hindi gumagana si kidney. The kidney will not be able to excrete the metabolites, meaning the blood will be staying, or the drugs, will be staying in the bloodstream. And because of that, it will lead to toxicity. Okay? Sige. Any questions so far?